Traditionally, TMD has been basically defined by focusing just on the joint, popping, clicking, gravelly noise, pain associated with it. We're redefining how we think about it, though, because there are so many other systems involved in what's happening. It's the muscles, it's the joint, obviously. It's also the teeth, it's the airway, it's how the nervous system is compensating for all of this. The posture is a big piece of the puzzle. So there's far more to it, we know now, than just focusing on the joint. Hello, I am Dr. Daron Clark, dentist in Nashville, Tennessee, and I am here today with my wife and practice partner, Lisa, and we are talking about the way we are changing the way we think about TMD.
Yeah, redefining it.
Yeah.
Redefining TMD. So tell me a little bit about what the regular industry standard definition of TMD is.
Historically, all of the focus has been on the joint.
Yeah.
Right? The popping, clicking, joint dysfunction. This is sort of the low-hanging fruit of it. And the sort of definitions have moved out from the joint a little bit in that there's an understanding there are other tissues associated with what's happening, but largely the treatment focus is very, very, very focused on just addressing the joint issues.
Yeah. And that can be kind of limiting.
It can be because there's so much more involved,
right?
The symptom set, if you look at the whole symptom set associated with TMD issues, it's really broad. It can be very confusing because it seems like those symptoms would be associated with other structures. And while those symptoms are popping up in other structures, they are a result of what can be happening with the joint. We really think about this in the context of it is the joint, but it is also the muscles that are controlling the jaw and the neck. It is also the teeth. It's also the nervous system. It's the airway. It's habitual posture. There are many components to this very complex system that all need to be in balance if a person's going to have health.
Yeah. So I know that in the past, most people think of TMD, and we talked already about the difference between TMJ and TMD, and you can kind of think of them as the same thing.
Right.
It's just the popping, the clicking, the locking, not being able to open your jaw. And so that definition of TMD has kind of limited people in a lot of ways. And what we do in our practice and what you do so well is kind of redefining what TMD is to be a little bit more broad. And it helps patients so much. What can we do this podcast to help educate and tell people more about the things that we're doing that are so powerful, that are changing people's lives. Can you tell them a little bit more about what your unique definition of TMD is?
Traditionally, TMD has been basically defined by focusing just on the joint, popping, clicking, gravelly noise, pain associated with it. We're redefining how we think about it, though, because there are so many other systems involved in what's happening. It's the muscles, it's the joint, obviously. It's also the teeth, it's the airway, it's how the nervous system is compensating for all of this. The posture is a big piece of the puzzle. So there's far more to it, we know now, than just focusing on the joint. Yeah.
So, and that's so important for so many different reasons. In your experience, why is it so important for patients that we define TMD this way?
Because people don't know they have it.
Yeah.
People will have ear issues and the ear issues are actually coming from a problem with the joint and the system, and they're going to an ENT looking for answers, but that's not where the answers are, because that's not the problem that the ENT treats.
Yeah.
There's also examples of, having muscle pain and going to your PCP for neck and back muscle pain, and they're getting muscle relaxers that are treating a symptom but not necessarily treating the problem, and the problem is coming from an imbalance in how the TMD system is working.
Yeah. Yeah. I mean, we get so many patients that come see us that are referred into us, and they had no idea that they have TMD.
Right.
The ear symptoms that you mentioned are a big one that I know that we've helped a lot of patients with. What are some of the, there's just so many different things that can mask as a separate condition.
Headaches are a really good example. 85% of headaches are extracranial in nature, which means they're not from something that's happening inside of your brain. They're from something that's happening outside of your brain. And a large majority of those are coming from excess muscle activity or imbalanced muscle activity. And that is a part of the constellation of things that happens when someone is experiencing TMD.
Wait a minute. So you just said that 85% of headaches come from muscle activity.
85% come from outside of the brain, but a majority of those are coming from an imbalance or excessive muscle activity.
Okay. And the reason that matters is because that means that it's solvable.
Correct. That means changing how the muscles are functioning, changing their positioning, can help resolve those headaches for patients and get them off of medications that they've been taking for the headaches.
So the first reason that, you said that it matters so much to define TMD this way is because there are so many people who don't realize that they have that condition. They might have an issue in one of those different systems that's maybe not directly related to the joint.
Right.
And in understanding that that's related to TMD, it kind of makes it addressable. It means that you might be able to actually solve those problems.
It does. And I think it's a good point in the conversation to bring up. So let's have a hypothetical patient who goes to their primary care provider with headaches.
Yeah.
The primary care provider will either address it on their own, or they may refer to a neurologist. And what happens when we go to a neurologist is they do exactly what they should do. They go through testing to make sure that we don't have something happening to us that is a threat to our life, right? We want to get imaging. You want to make sure that there's no life-threatening conditions going on. But then typically the next step is we get medications for the symptoms.
Okay.
And what didn't happen in that course of things was an identification of cause. Diagnosis is a description of what's wrong, not a description of what's causing it.
Yeah.
So we're sort of...
And is it because they don't know?
Right. Well, some do. I mean, we get referrals from neurologists. We get referrals from sleep doctors. We get referrals from ENTs who sort of have an understanding that what their patients are experiencing are not necessarily solely related to their area of specialization.
Yeah.
And we have the training and knowledge and ability to address this whole system. So we can help solve those problems that are more complex than just the one area that specialist is working at.
Yeah. So, you're talking about an example of a patient who goes to see their primary care provider, and then they go see a neurologist after that. And the neurologist then says, you have headaches, you have pain, you have and then they're given medication.
Right. Which is symptom management. And the patient then in that scenario doesn't ever get the opportunity to talk to somebody who might be able to get them help without having to rely on medication. Right.
Yeah. And I feel like that's a lot of what we do. It's a lot of what
we do.
You do on a daily basis.
Thankfully, we have a lot of other providers of other disciplines who have an understanding of what we do, and they can, when they can't solve the problem, they can get their patients to us so we can help nail it down.
Yeah. Well, and the other, so in terms of going back to the idea of redefining TMD, just from the joint to a broader understanding of it.
Right.
I feel like the other thing that's important to talk about a little bit is that it also helps patients who have traditional TMD symptoms to think about it this way. Because if you have just popping, clicking, gravel sound, locking, really typical TMD symptoms, if you see a provider that is only focused on that one system, then you're kind of missing the bigger picture, right?
You can only solve part of the problem if the problem is more complex. That's right. An example would be a patient goes into see an oral surgeon for popping, clicking joint issues, and there are multiple options available within the surgical setting to address that. But they may have a myofunction or sort of a muscular habit issue that's causing that problem. They may have something that's causing them to clench and grind their teeth, and the first symptomatic effects of all of that are problems within the joint when the real issue lies somewhere else. And that's not necessarily just treating a symptom, that's treating the problem, but it's treating only part of the problem. So part of it gets addressed, and then the symptoms that are coming from the other issues still persist.
So they don't get comprehensive solutions. They don't get solutions that look at the root cause.
Right.
And that means that probably is why a lot of people don't get the results with other providers who just kind of look at one piece of this puzzle that they would get with you when they come to see you.
Correct. Because we look at every aspect of this. We look at every system that's involved. We identify if there's an issue with that system, and then treatment is designed to address all of those systems at once and bring everything back into balance.
Sometimes there's a lack of clarity about what will work and what won't work for patients. So they may see a provider who recommends Botox, for example, and the provider won't necessarily know whether or not Botox for sure is going to work in that specific example with that specific patient, because they are coming from the perspective of, we treat with this tool. This is the tool that we have. Instead of looking at the patient first to see which of all of the different tools that we have can we combine and use to treat the patient.
So this reminds me of a patient that we've seen. The patient had a history of what everyone thought was ear infections. Yeah. And the patient would go see the ENT, suspicion of an ear infection, antibiotics and steroids. Antibiotics and steroids are going to reduce the inflammation that's there, so it's going to solve that symptom. And then if there's an underlying problem that's actually causing it that was not necessarily ear associated, then the symptoms are going to come back, and that's what the patient was experiencing.
Right.
That patient was lucky enough that the ENT recognized that something else was going on and referred that patient to someone who treats TMD. And that provider only addresses joint position. Yeah. So they went through the process of repositioning the joint, changing the patient's bite, and some things got better, but there were still a lot of symptoms associated. What I was able to do was recognize that there was more to that circumstance than just the joint position. Yeah. So the way we approached it is, yes, we paid attention to the joint position, but we also paid attention to what the muscles were doing, like the jaw muscles were doing in that joint position. And we also noticed that there was a myofunction problem. So there was a tongue function problem that not only was contributing to the pain that the patient was experiencing, but actually was also contributing to some airway issues at night that were affecting their sleep. And we were able to address all of those systems at once, and we got that patient to a much better outcome.
Yeah. Yeah. So that patient was able to, it's so crazy, have such something you would not ever think is related to the joint at all. Right. Right. Like if you just think about that patient's kind of journey, you start with, I have this ear problem. It's affecting my life. Then you see an ENT. They say, it might be an ear problem. Try. No, nothing's really helping. They send you to a TMJ provider that's just focused on that one kind of more old school definition of TMD.
Right.
They treated that problem, which helped, but it didn't really get rid of all of what was going on.
No, maximum symptom improvement.
Yeah.
For sure.
And without having this understanding, you wouldn't have seen it either. Without
Correct.
the education and experience that you have, you know, 10 years ago, you wouldn't have seen the potential in that either.
Right.
But you were able to take that patient and give them much better results, get rid of a lot of their ear symptoms, get rid of their pain and discomfort more comprehensively.
Correct.
Yeah.
Another example of this that we actually see a lot of is, and it's a very common thing for people to have upper back and neck muscle pain.
Yeah. Yeah.
And
Yeah.
a lot of those patients, what they're actually dealing with is a problem with their tongue's ability to function as it normally would.
Interesting. Yeah.
So they have a myofunction problem. They have what we would refer to as a functional tongue tie. So they're not having speech issues. They probably didn't have feeding issues when they were a baby, but their tongue can't function within their mouth in an ideal way. So what happens is other muscles have to start making compensations for that. And some of the muscles involved in that obviously are in your jaw, but also in your neck and your back. The stabilizing muscles for any movement we do with our jaw are in our neck and our back. So you can have symptoms translate from a tongue function problem that will cause chronic neck pain and back pain. So if you can recognize that and treat the myofunction issue with the tongue,
Yeah.
maybe release the tie if it's needed,
Yeah.
then you can change that chronic neck and back pain profoundly.
Yeah.
And you're usually going to have an impact on their sleep quality and their airway along the way.
Yeah. Yeah. And I also feel like a lot of headache patients don't necessarily recognize that they are dealing with an issue that is solvable. Like you mentioned that it's so important to think of TMD this way because a lot of people don't recognize they have TMD.
Right.
I personally was an example of that because I did not have any popping or clicking or gravel sounds
That's right.
in my joint.
That's a very good point.
I didn't, if you told me I had TMD, I'd be like, no,
There were no real joint signs or symptoms associated with
never
with
or ever would have looked for somebody who even had experience in that. But headaches in general are often, we think that headaches are just something that you have to have instead of thinking about them as something that you can actually do something to get rid of.
Yeah. You know, the headache conversation is really interesting because, and this kind of comes back to, it's so important as to how the way we think about something changes what we do with it.
Yeah.
So many people have triggers for their headaches.
Yeah.
And it could be like, it's just like such a bizarre list of things. It's like a certain blue light or the smell of garlic or
Chocolate.
yeah. Whatever it is. Or a bottle of
somebody
whiskey.
Somebody told me cinnamon one time.
Yeah. Or a bottle of whiskey gives me a headache. Well, we know how that happens. But
Yeah.
but why would something so seemingly minuscule have such a profound effect on someone's pain experience? And one of the ways that we think about this is what we call the well of tolerance theory, in that your body has a capacity to absorb or has a bucket where it can put all of the stressors in. Mm-hmm. Whether it's emotional stress, psychological stress, physical stress, physiologic stress, your body can deal with all of these things until that bucket overflows with those stressors.
Yeah.
And one of this well of tolerance theory and how we think about its association with headaches is the trigger is not what caused the headache.
Yeah.
The trigger is what pushed what caused their well of tolerance to overflow.
Yeah.
And as soon as it does, then we're going to start getting pain and symptoms from it.
Yeah. Yeah. And I mean, migraines are an overstimulation of the trigeminal complex, right?
Right.
So all of that noxious stimuli that you have in your body builds up. And then you can have that one thing that just kind of kicks it over the edge.
Yeah.
And it's helpful to eliminate that one thing, right? But then as you get older, you might reduce the number of migraines or headaches that you have by getting rid of that one thing
Sure.
for a short period of time. But as you get older, your well of tolerance actually shrinks.
Does not get bigger.
Yeah, we're not all getting more resilient as we age. So your well of tolerance shrinks and your body's issues increase at the same time. So that's why you kind of end up having these symptoms that will come back in 5 years or 2 years or a decade, whenever it is. But if you step back for a second and you think about what's filling that cup in the first place, what's the biggest thing that is having an impact on it?
Right.
Right. Instead of just the last thing, what's the biggest thing? If we can remove that, then we can profoundly help people with headaches and migraines.
Yeah, that's right.
And that ties back into, you have to look at all of the body systems that are related to these pain conditions in order to really help people.
Yeah. It's interesting. And you brought up the trigeminal nerve and its association with headaches. Your trigeminal nerve is one of the biggest, most profound cranial nerves that we have. A cranial nerve meaning it doesn't come out of your spine; it comes directly out of your brain. And the trigeminal nerve is wildly complex because your trigeminal nerve it controls motor function. It receives sensory input for tactile. It is part of your taste. It controls one of the muscles in your eye.
Yeah.
It has input for what we call your autonomic nervous system, which is sort of like your fight or flight syndrome versus being relaxed and chill.
Yeah.
And it's so complex. It can manage and deal with so many things. There are estimates that 50% of what your brain is processing at any given moment during the day is actually coming from your trigeminal nerve. So it makes sense that if the weight of what it's dealing with is too much or close to it, and then that one thing pushes it over the edge, then we find ourselves in a situation where we have a headache. And then we stay with that well full all the time.
Yeah.
And then we have a situation where chronically headaches are just part of life.
Yeah. 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 Well, so you mentioned, all the different things that the nervous system affects, right? And I think that makes me think about all of the different things that patients will be experiencing, and then they don't recognize that it could be related to TMD, right? Taste, dizziness, vertigo. We end up treating a lot of patients who have like Ehlers-Danlos and other, complex conditions that are related. But ultimately, there's so many different types of treatment out there for TMD, right? And you've got Botox, you've got myofunctional therapy. We have MLS treatments and SPG blocks, and there's all these different things that you can do to help patients. Mm-hmm. Different treatment options that you can offer patients, and each piece of the puzzle, each treatment option is going to help one or two systems. It might help your nervous system and inflammation in the joint. It might help and so because of that, coming up with a treatment plan for a patient for you.
With multiple treatment modalities.
Yeah.
And those treatment modalities assigned to address the specific things that we see in each patient's circumstance.
Yeah.
That's the key to success in getting the maximum resolution of this.
Yeah. So when you see a patient and they come in, they are a unique kind of puzzle. You have to look at that and see, all right, which specific treatments do we know that we can do very well that are going to give you the maximum results in your unique case? Yeah. Depending on which of those systems they're having difficulty with.
That's right.
Right. And of course, they all affect each other, right? All of them. I think we had a patient that we saw who was having actually a lot of sleep breathing issues. Mm-hmm. And I think she was actually referred in to us by a sleep doctor in town to be evaluated to see if we could help with the sleep disorder. We had a conversation with her and come to find out that she actually has neck pain and headaches, morning time headaches when she wakes up. And she has vocal dystonia. And in Nashville, that's a
big deal.
Yeah, it's kind of funny how many patients we see with who come to us specifically because they have vocal issues. Which is not something you probably thought that you were going to get into when you decided to be a dentist.
I did not.
No, that was probably not. That was not something you planned for.
Did not know I was going to be affecting that.
Yeah, but because of when we treat patients who have muscle tension and tightness in their neck and they have improper myofunction, so the way that they are swallowing and holding their jaw and all of those details that fall under myofunction. When we're able to get that to calm down, we relax the muscles of the neck and shoulders. And you can actually have a huge impact on patients who are dealing with that condition.
Yeah, it's been really interesting to see. And that's not the only patient that we've seen that in. Chronic tension, muscle tension within the jaw and the face will almost inevitably translate to chronic muscle tension down through the neck. We talked earlier about how those things are associated. And if there is chronic muscle tension for a singer, then that is a limitation on how much power they can produce with their voice. It is also a limitation on how long they can perform, because they're really pushing the limits. These are athletes, okay? They're using a muscle system to perform an act. And if there's too much tension, the system never gets to relax.
Yeah.
Then when they get into those moments where they really need to push themselves to perform, their body's not capable of managing it.
Yeah.
And they get fatigue and they get pain associated with what they're trying to do. And that's where it comes from.
Those muscles have already been running a marathon before they even get to the point where they're supposed to kind of do what they need.
There's no rest and recovery if there's chronic facial. There's no rest and recovery for the musculature in your neck if you are living in chronic facial tension.
Yeah. And again, all this comes back to, if we weren't looking at TMD as a complex problem across multiple different systems, then we wouldn't be recognizing our ability to change people's lives in these types of examples.
Yeah.